So a lot of people have questions about what's the recovery like, what's the downtime after these procedures. It's generally pretty gentle. If I look at all the spectrum of patients that I take care of, I have some patients who literally have no pain from day one and do great. I've had one patient who took as long as 3 weeks before she developed pain relief after the procedure. I would say my average patient is recovering for about 5 to 7 days. Many of those patients by the end of that first week will already have experienced substantial pain relief. We're tabulating study data right now, but I would estimate from what I've seen on the data that we've collected, we're getting average patient relief scores in the range of 70–80% relief. And a lot of these scores are achievable as soon as 1 week. Certainly by a month out, we have these good numbers on most patients. It's been my practice not to do any special physical therapy for folks. I tell them to begin to just move around, ambulate, do your daily activities as you feel able to, based on their comfort. Most people, again, will have fairly minimal comfort by a week out. As far as specialized physical therapy, the only thing special I'm doing primarily with the shoulder is doing range of motion exercises. I tell my patients who get the shoulder procedure that I want them to work on only range of motion for the first 2 months. I do no strengthening exercises during that time. And my goal is to get 100% of their shoulder motion back within those 2 months. I'm extremely disappointed if I don't get that. The vast majority of my shoulder patients have all their shoulder motion back at 2 months. And generally what I teach them to do is the itsy bitsy spider, shoulder pendulum exercises, laying on the bed and doing snow eagles, getting them to progress to going into a pool and just trying to exercise in that environment, just working on motion. The strength always comes later. Don't forget that most of the shoulder patients, it's not just shoulder arthritis. Vast majority of them have damage to the rotator cuff and to the supporting structures around the shoulder. So it's very important that those structures be addressed during the ioCore repair as part of the repair. Soft tissue mobilization should be the key focus in the first few months after the procedure. For folks getting hips, knees, ankles, if they're normally walking about, they already are getting plenty of motion. The biggest factor that we found in the post-op period for patients who haven't done as well is if they have a lot of knee instability, many of those patients will have to go into knee supports to help keep the joint more aligned. Many of the folks will have varus or valgus deformities of the knee, which will limit their potential success with the procedure. So that needs to be part of the evaluation, and maybe those people will need specialized bracing after the procedure. But if they don't have angulation deformities in the joint, don't otherwise need protective or restricted range of motion, the vast majority of people, I just allow them to advance their activities as tolerated. I tell them they may shower right off the bat, but not go into a pool, not be in a bathtub or any water under pressure. Most of my dressings just involve putting steri strips on the wound, fairly minimal closure, and I just told patients let them stay on till they fall off from boredom. Generally they'll be off in 1 to 2 weeks. Recovery for most people is fairly quick and easy.